One thing that jumps out to me as we consider the relationship between technology, automation, and the care economy is, of course, telehealth, virtual healthcare. I represent a district in southeastern Minnesota that's mostly rural, and during COVID-19, many of my constituents have relied on virtual healthcare to access their needs. Dr. DuBravac, I know you've done extensive work on digital connection and how data is playing an increasingly important role in the delivery of services across the country. I'm curious to see how you see these themes playing out in the healthcare sector.
I think, as you mentioned, clearly telehealth has a vital role moving forward. And when you look at the urban-rural divide, you still have a significant difference between the percentage of households that are taking advantage of telehealth in urban areas versus rural areas. By some estimates, it's 25 to 30% lower in rural areas. When you look at the divide between where physicians practice, you also see a pretty significant difference between rural and urban settings. The rural population is about 20% of the country, and only about 11% of physicians practice in rural areas. So you're already at a deficit there. And then you compound that by the fact that people who are in rural areas face much higher rates for some of the needs of healthcare, and so you've got this kind of dual burden that falls on those in rural areas. So, I think as you alluded to, things like rural broadband can help close that gap significantly, and I think it also helps drive some of the innovation more broadly that have been talking about. As we move to a remote work environment and more employers support remote workers, some of those remote workers may opt to move into more rural settings, but they will need broadband in order to facilitate their jobs. If they do take what have historically been higher incomes into some of these rural areas, then we might start to see some of these trends reverse. We talk about patents in rural areas could increase if you have some of these professional workers working in these areas. So I think rural broadband can significantly move the needle, both for telehealth services, but also more broadly for the innovation that we want evenly distributed in different populations.